And we're also going to go Facebook Live. And Babs, it looks like we have about, the registrants are now joining, so we'll just give it a little bit.
Great.
Seeing all of them join here. So we'll be starting in just a little bit.
Great.
Okay. So look, we're already getting questions and everything, Babs, so go right ahead.
Excellent. All right, so let's get started. All right. Hi, everyone. Welcome to SEEK's special edition webinar, School Reopening Parent and Teacher Staff Town Hall. This webinar is brought to you by Milestones Behavioral Services. Thank you, Milestones. For more information about Milestones, and you can check out their back to school services, you can visit their website at www.mbs-inc.org. Milestones Behavioral Health is also our first SEEK Professional Network Platinum member. You'll hear more information about our membership drive, our SEEK membership drive, and how you can become a member of SEEK in just a few weeks. I'm Barbara Distinti. I'm the president of SEEK, and I have a child in special education.
Hi, I'm Julie Swanson. I'm a special education advocate. I'm the past president of SEEK, and I have a son who is 25 years old who has autism, who's been through the special education system.
Hi, everyone. I'm Jeff Forte. I'm a special education attorney. I'm also the executive board secretary for SEEK. And welcome, everyone. Thank you all for registering for tonight's webinar.
Hi, I'm Andy Feinstein. I'm a private attorney in Mystic, Connecticut, with a child in the Stonington schools. I am the legislative co-chair of COPA, the national organization, and the legislative chair of SEEK. Glad you're here.
Hi there, I'm Jen Laviano. I'm also an attorney in private practice in Connecticut, and I am the co-chair of the Attorneys Committee for COPA, the National Organization of Parent Attorneys and Advocates. I am also on the SEEK Executive Board, and we all are pleased to have you here and hear from you.
Great. Okay, just real quick, just so you know, our mission at SEEK is to advocate, educate, and legislate for the 80,000 children in special education in Connecticut. We also work on behalf of children with 504 plans and children who should be identified but are not. You can find out more about SEEK at seekct.com. And a reminder, we are a nonprofit organization. We're all volunteers, but we do accept donations on our website, as we do incur operating costs in order to lobby in Hartford and increase our accessibility for our audience. Jen, can you give us our legal disclaimer for the night?
Yes, I will give the disclaimer. So while many of us are attorneys, this is not intended to be legal advice. This is a webinar where actually we're going to be hearing mostly from you. But to the extent we try to respond to some of the questions that come up, etc., please don't interpret that as legal advice. It's not how it's intended. And to that end, we ask that if you ask questions, whether it's here through the webinar or I am monitoring our Facebook, where we're streaming live so that I can see if there are questions there. Keep in mind, this is a public forum. We are recording this webinar, and so keep your questions both general so that as many people as possible can benefit from them, and also know that if you're asking a very specific question about your child, we don't have enough information to give you legal advice at this point, and that's not how this is intended, okay? Thanks.
Great, thank you, Jen. All right, yes, just a reminder to everyone, we are recording this, and we are going to be asking for you to raise your hand when it's time for you to ask a question. Just so you know how this all started with this webinar, individuals at the State Department of Education have asked us individually and collectively, what are the parents saying? What are teachers saying? What is school staff saying? So tonight, that is really a listening session for us. We want to hear your questions, comments, and concerns about the state's reopening plan for the fall. Do you love it? Do you not love it? Are you somewhere in between? This is when we would like you to let us know. Now, the first thing Jeff has done, and please, again, bear with us a little bit. This is our first webinar when we've had so much interaction. So Jeff has set up a, form at the beginning, a question for you. So if you can answer that form, we'd like to know if you're comfortable, you plan to send your child back, yes, no, or you need some more information. If you could answer that question now, that would be really helpful for us. So we're going to talk about a number of topics, and if you want to participate, we'd like you to raise your hand. There should be a raise hand button at the bottom of your screen, and one at a time, and we won't get to all of you, and Jeff will let you in. You have the option to be on camera or not. We could just hear you, or we'd love to see you, but we understand if you don't want us to see you. So we will do this one at a time. The topics we want to discuss are transportation, opt-in, opt-out possibilities, CDC requirements, medical waivers, social emotional concerns, and we want to hear from educators and teachers and staff. And what are your concerns? So this is the gamut. We have a lot of things that we want to talk about, and we're happy to get started. So Jeff, I'm sure we have quite a few questions. Yes?
Yeah, so right now, I just want to reiterate what Babs just said to our attendees. So this is our first kickoff here. Some people are asking if they should be asking the question in the chat room, but we don't want you to do that. We actually want you to go ahead next to your name, to your participant name, and raise your hand. Oh, great, we have a question. So I'm gonna call on, I'm sorry if I'm mispronouncing your name, Renee, but Renee Mercado has a question, and I'm going to her. Oh, it just went alphabetical here, so let's see where she is. Oh, well, she just dropped off. So we have Christine Agosto. Okay, so Christine, promote. Hi, Christine, are you there?
Oh, yes, she's coming in.
She's muted.
She's,
Oh, there you go.
Unmuted. Hi, Christine.
So, I'm work with
Christine,
We can't hear you.
Can you hear me?
we can't really hear you. You're breaking up quite a bit.
Okay. Can you hear me now?
Not so much. No.
Let me see.
Should we go to someone else and then?
Somebody said she posted her question in the Q&A, so I think I can pull it up if you want, okay?
Okay.
Christine's question was, what are the schools going to do for children who won't be able to wear masks?
Excellent question.
And the answer, according to the state plan, is there's a medical exception for wearing masks. There's no definition as to what that medical exception is, who decides on it, how you justify it. That's going to be up for the local school districts. Just to set the context of this, each district has to submit a plan to the state by Friday. The state is going to review those plans and offer advice. I don't know if they're going to disapprove plans. They say they're not going to, but we've had word already that they have disapproved plans. In any case, those details will be part of that plan, we hope. And it's something that you probably ought to deal with your local school board to insist that there's a exception provision that covers your issue.
Great.
Can I just add something here, please?
Yes, Julie.
I really want to remind everyone that, hand washing, social distancing, and mask wearing are the new essential life skills, okay? These are adaptive skills that are essential to our safety and health. And depending on your student, your child, and whether or not they have lagging skills in those areas, please reach out to your team formally and ask them to incorporate those skills as IEP goals and objectives under adaptive functioning on your IEP. Most schools are still having extended school year right now. Reach out to them, ask them to be added as IEP goals and objectives, and ask for parent training around them. If there's a board certified behavior analyst or someone who understands behavior, whether it's a school psychologist or whomever on your team who can help you with that. But, you know, ideally, you don't want to walk in on the first day of school and not able to wear a mask if you still have the potential for your child to learn that skill, a very important adaptive skill. This is like my pet peeve. So it was actually going to be my takeaway, but I'm even going to say it again at the end. That's how strongly I feel about it.
Thank you, Julie. Thank you very much. And thank you,
Sure thing.
Christine. That was really kicked us off with an excellent question. Thank you so much.
Add just one more thing too. You know, another question that districts are trying to resolve right now is who's actually going to be responsible for providing them. Is it going to be the parents that are supplying their own children with masks? Or is the district required or needing funding to provide the masks? And if so, are they disposable masks? Are they washable masks? So that there's a lot of that in addition to just practically speaking, who's going to actually be providing the masks. And we also just have here another that there's some guidance coming out for children who can't wear masks coming out this week, and that staff working with these students will be recommended to be wearing masks themselves.
And Jeff, could I just add to that there could be protocols in place around those IEP goals and objectives as to how to keep that mask germ-free before it's put on and what to do with it after.
Great.
To your point.
So I have Renee on now, Babs. Can I unmute Renee Mercado? Renee, are you there? Let's see if I can unmute her. Ask to unmute.
Can you hear me?
Hi, Renee.
We can hear you.
Hi, how are you? My question is, I'm a mom with 2 special needs kids, but I've been following the whole COVID thing because it's going to be a big thing, not only for our special needs kids, but they're going to be put in a pool with regular kids that are going to have a lot of anxieties, okay? So they're going to be, I know we're here about special need kids, but my concern is we're going to have a lot of regular ed kids that are going to be put into these protocols. What is going to be put into place for those kids that are going to be struggling just as much as our kids? Because there's going to be a lot of heightened behaviors for regular ed kids. It's going to be like, there's not going to be a delineation between the two at first. And I think it's going to be a lot of pressure on the school putting all these kids back at once. Does that make sense?
Yes, it certainly does.
So the state plan does contain guidance on social emotional learning and the need for enhanced mental health services when all kids return to school. There's nothing very specific about it, and there's no separate funding train for it, but social emotional learning has become one of the new really, hip phrases these days, and it's clearly part of the state plan. And all district plans will have a section on that. But frankly, what they're going to say is that existing staff is going to meet those needs, which we all know is not going to be sufficient.
Well, what's going to be difficult too is you're going to have children coming back to school where they're in a family home where they're not used to talking about that or addressing that. So it's going to be difficult. Is there going to be things that are going to be able to be sent home, or do you know does that make sense?
Yeah. We don't know yet.
Yeah.
Right?
But it's a great point. Absolutely. I think it's absolutely a great point. So thank you.
But it's a great concern.
And it's something just I wanted to add to that, Renee, which is that, one of the things we've all been talking about and thinking about is that there are many students who prior to the school closure may have had, mild anxiety or some mild concerns in that regard for whom the school closures and the pandemic have dramatically increased their anxiety. And they may be going back to school. They may have left as a student who didn't require any formal support, and they may be entering as a student who does. And one of the things that we're very cautious about, and we want to make sure parents are very informed about, is that if you have noticed a dramatic change in your child, for the better or the worse, over the course of the school closures, that's information your school team needs. And if your child's not previously been evaluated, it might be time after things settle down to ask that the school take a look at your child if they're really struggling in that regard.
Well, maybe this is something that parents could start getting on top of now before we bring them back to school.
Agreed.
And indeed,
You
and
mean-
indeed, the state plan talks about that.
Okay.
Whether that happens is another matter.
Great.
Okay. Well, thank you very much.
Thank you, Renee. Thank you so much.
Thank you.
All right, Jeff, who do we have next?
Okay, I'm gonna just start taking them in order. We have Bonnie Newman.
Okay.
So let's see if we can get Bonnie in.
Hi, can you hear me?
Hi, Bonnie.
I can hear you.
Hi. Andy, you probably remember the name. You haven't seen my son since he's been about 7. He's now 19. And I wanted to know if there was any guidance on community partnership programs and transition, because a lot of what our group needs for the transition is to get out into the workplace, to get into work environments and learn living skills, and some of us are going to colleges, but I don't see any guidance on what schools should be helping us or what we can or cannot ask for. In just don't know where I'm supposed to go with this, and I've got a PPT in a couple of weeks to iron this all out. But it's a general question because we're all, us in this age group, is wondering what guidance there is on what we can do with these job transitions and community workspace.
So one of the things, Bonnie, that I think you should know, and Julie, I'm sure was going to mention this at some point, but all of our previous webinars and our Seek This Weeks are now up on our website, which is seekct.com. And we had a webinar, oh gosh, about a week or
I was on it.
Okay, great. So I was just going to encourage you to go and look at that. In terms of guidance, Andy, do you want to address this issue?
Well, I mean, no. Simply, there's no waiver of the IDEA. Your child's entitled to a free, appropriate public education, which includes transition services, and you have the right to demand that. Now, I am quite concerned, quite appalled by the fact that one of the reasons that there's this pressure to go back to school is so private employers have employees that show up at work. They don't have to stay home and take care of their kids. Why on earth are we not reaching out to private employers to be part of this plan? It's as if they don't exist. That's obviously a question for transition, but it's a more general question that if the big companies are the ones who are the big beneficiaries of our kids going back to school, and this costs a ton of money, they should be paying for it.
But Bonnie, one of the things that we've talked about a number of times, and I just want to reiterate, is that there are going to be new rules in the job sites that a lot of students had been planning on going into as part of their transition program. And as Julie mentioned before, with regard to life skills in general, in terms of the many health rules that are in place in businesses, that's something that if it wasn't previously in your child's IEP, you certainly should be advocating that we put into that IEP goals and objectives that address whatever expectations there are at these various jobs that your son or daughter comply with. So, it's a whole new world, and we're aware that it's scary, but we very much encourage parents to make sure that those new needs are in the IEP.
Yeah, the job skills is what, we have very few precious time to get those job skills in. And if we can't, if the school can't do it, or employers aren't letting our kids in, which is what I'm hearing from the school system, how do we push that? Because that's what we want, the skills. We want to get those skills.
So I'm going to ask the attorneys on our board if that's a compensatory education issue that's potentially perhaps after 22. And I don't know the answer to that, but I do know that what I was going to say is, back to what Jen was saying, the devil is really in the details on what you get into that IEP, about all the protocols around that. But, is that a compensatory issue? Compensatory education issue?
Depends, but what I would say is if the prior plan for a job shadowing opportunity or an employment environment is no longer available because that business is no longer welcoming people, or they're closed or whatever,
Sure.
The ultimate obligation is the IEP team's obligation, even if an outside agency is no longer willing or able to provide that support. So you need to make sure that the team readdresses it and finds a new location or a new plan. So that's a simple answer to a very obviously complicated question.
That's, I just wanted to know the groundwork, but I thank you very much because, you know, the transition's been a tricky issue.
It always
Certainly is.
much.
Thank you.
Thank you, Bonnie. Thank you so much. All right, Jeff, who do we have next?
Okay, we actually have a question from a teacher in the chat room that I thought might be good to pose to everyone. So I'll go ahead and read it. It says, I know that there are recommendations for plans to reopen, but will there be certain must-dos for all districts? I teach in one district and my kids go to school in another district. I have seen very different plans from both districts. As a teacher, I am concerned that I will need to go back to school, back full-time in person to school, but my kids might be going back in person part-time. My daughter with special needs will need care, but I will have no one to care for her if I'm working full-time.
Okay, the state plan has, under each subject, has mandatory things that districts have to do and have discretionary things that districts can do. The basic plan is that all kids go back to school full-time. And that's what the state's assuming, and that's mandatory, and that would be across districts. If, however, districts can't do that or have to move because of an increase in the disease to some other plan, we could very much end up with the discrepancy between different districts. And that's been the state's modus operandi all along, of trying to do things by guidance and not by direction. And so that is a real problem.
Mm-hmm.
Okay, I've got Melissa Sullivan. Let's promote her to talk. Hi, Melissa, are you there?
Yep, I'm here. Can you hear me?
Hi.
Hey guys, thanks so much for doing this. It's going to be, I'm sure, extremely helpful. I was just typing to that mom who was just talking about transition. I tapped into something through, is it BSR? Is that the right acronym?
BRS?
BRS, thank you. Thank you, Julie. Yes.
Bureau of Rehabilitative Services.
Yes, thank you. I have more acronyms that I care to admit.
Sure.
They actually hooked my son up with Level Up. So I'm not sure that's in every town or not, but that is an awesome service. And they could get your son a job this summer for sure if you could get in there. So just a footnote. But I actually wanted to kind of go back to masks for a second. My son is actually medically unable to wear a mask. He's actually going to school in Massachusetts, so I have a whole new ball of wax, and this really doesn't even apply to him. But I've been in touch with so many parents, and I've been working with Jen and trying to help these parents, because there are certainly children, no matter what we do, Julie, to put it in their IEP, that are physically, mentally, and my son is one of them, and he's 16, unable to wear a mask medically. So
Sure.
Those are the kids I'm really concerned about. Those are the kids that need to be addressed. I understand we're leaving it up to districts as of right now, but I want to know kind of what you would say to these parents, because, you know, I know of a mom in Enfield, and, you know, they flat out told her, and she had a doctor's note and everything, and they said, nope, sorry, your kid's not going back to school without a mask.
Well, first of all, let's talk about what's called an individualized health plan. And that's an attachment to the IEP, the Individualized Education Program. And you can absolutely have a written up plan protocol on what the procedures are for a certain child for a health issue. And I don't know, you know, if anybody else on the SEEK board wants to pipe in about that, but that's where I would have an IEP team with the nurse and whomever the medical professional is who is working with your child or the student, and whatever their input is, whether they're on the Zoom call or it's just a letter, and propose protocols and have them written up, and that there should be training of the staff around those protocols to keep that person who is medically unable to wear a mask or whatever, or any other viral health and safety skills for that matter, and have training around those protocols. Does anybody else have anything to say about that?
Well, the big
Ryan?
difference is that a health plan is not enforceable the way an IEP is enforceable.
Okay.
And so I would argue that you do it as an accommodation in the IEP, and if they refuse to give it to you, then you have the right to go to due process to force it.
Good point. But however, just having that piece of paper that has the protocol written and ask for training around it is an IEP issue and is something you can ask for in prior written notice with a yes or a no. And if they say no, they have to give you a good reason why they're saying no. And at least, you know, you can at least try to angle it that way as well.
So Melissa, this also dovetails with another question we have in either the chat or in the Q&A about the difference between parents who choose not to send their children back to school because they're uncomfortable with it versus those who are medically fragile and they can't be sent back to school for various reasons. And I think what we will say, no matter whether we're talking about through a healthcare plan, the IEP, or an accommodation in the IEP, it's essential that you have your medical team together and the documentation is rock solid. And so that you can present that, because as it's written up, and I know you and I have spoken, Melissa, but as it's written up in the plan from the state right now, while the districts are required to have medical exemptions, there's no detail about what the criteria is, how any parent is about asking for it, what their rights are if they disagree. And so it's very—
Well, I need to clarify that. For a medical exemption for wearing a mask, that's unclear. That's there's got to be a medical exemption, but the details of that are not clear. The state plan is, however, excellent on the question of parental choice. A parent has absolute right to keep a kid home, and the school is obliged to provide remote learning to that child. And you know, we ought to give compliments to the state for that, because that's way above what's happening elsewhere.
The and regular ed and all of it, right? That's for both.
The one wrinkle in that is that at least as of 3 o'clock today, before the meeting, the president was taking the position that unless all kids were required to be in school, federal funding to the state would be cut off. I think in the deal that's being worked out now in the fourth COVID Act, which text should be available on Friday of that, I think that's dropped out, but there could be some federal law on that, which could be very difficult. Obviously, the Democrats in the Senate are not going to stand for that, and the House will never agree to that, but that is out there, the pressure to force everybody back into school.
Can I just add one more thing, Melissa? Also, if you're going to have an IEP team meeting, or you could request it in an email, ask for your present levels of academic achievement and functional performance to be updated in the column, in the box that is delineated for healthcare. Or I think it says medical. Help me with this. What does it say on the paperwork, everyone? Healthcare needs or medical?
It just says health. Are you talking about present levels? I think it just says health.
Right. So, you know, I'm back to documenting this as best you possibly can. And as Jen said, if you've got all the documentation from a doctor or other medical professionals, this is where you can submit those reports and have that information on the health box on the present levels of academic achievement and functional performance. So that's just another thing I wanted to mention.
From years ago saying something along the lines, it's something I've never forgotten, something along the lines, Jen, of, you know, I had something medical that needed to happen for my son. I think it was around an air conditioning, and they wanted to give him a 504, and he had an IEP, and instead of writing it in accommodations, they were just giving me such a hard time. And Jen said, just say to them, do you know more than my child's doctor? And that has stuck with me because, you know, like this woman has a note from her child's doctor saying her kid cannot wear a mask, and Enfield is saying, nope, sorry, your kid's not going to school, and stuff like this.
Oh,
I mean,
boy.
yeah, we're in, you know, we've got a lot of stuff going on, and parents are already stressed, especially special ed parents,
Well,
in homeschooling, and this is just something that's not needed.
So lawyers, please pop in here, attorneys, but would this also not be a good opportunity for you to say, could you please provide me the statute or the guidance or you know, what is that statement based on? What statute, what guidance, what legal authority? If they say they can't,
Sure. If
well,
they flat out refuse it, you of course want to know, ask them to document their reasons why. And if
Right.
it's in an IEP meeting, it's supposed to have there's supposed to be some cogent explanation for it. So
right.
it's
Okay,
all
Julie,
very
I'm just gonna wrap this up because we.
Okay,
have a lot
wrap it
of
up.
days. I'm so sorry. We can, we definitely, anything that we have that is left hanging, we can follow up with emails and all the rest of it. So we have all the technology. So let's move on. Jeff, let's go have our next question.
Okay. We are going to David Steinberg.
Excellent.
Hi, David.
Hi, David.
Hello.
Good to hear from you. Hi.
All for this. We all of us through time and for your effort doing.
We can't hear you too well. Sorry.
Sorry, I actually have I have a
That's
300 megabit connection, but today for some reason it's unstable on Zoom.
Sounds good now.
Okay, thank you. Thank you all of you for being here, for doing this for us, because obviously, you know, you're making, you know, piles of cash off doing this. You're helping us, your parents yourselves. You know, it's important to us. But I do have some concerns I'd like to voice and some thoughts about everything that's going on, and maybe you guys could weigh in on it. I'm going to make several points, and you know, maybe you guys could address whichever ones that you think are, you know, important to touch on. You know, with the current situation that's happening with the elevating virus numbers, we're not reopening. I work for NBC Sports, and we're not reopening our facilities unless absolutely critical to keep you on the air until at least next year. You know, we don't have school board meetings in person. We had a school board meeting last night for ER9, and you know, we attended that via Zoom, just like this. Same problems. I wonder if it's Zoom. But anyway, you can't have it in person. You can't walk into the DMV one at a time and with prior arrangement. They're rushing to open schools and jam kids into there. And the joint education meeting from last night, ER9 Union, concern that you know, that are raising for them as also as parents, you know, that they have differing schedules, being in different school districts or where you teach and where you live. And I think there's another teacher that mentioned that in the Q&A. You know, also exposure dangers for them to put out there into the public, into a very crowded environment. Is social distancing. You know, the exposure for danger for the, you know, and this is a real concern for me. I mean, we had COVID losses. We buried some of our family. I actually couldn't even be at some of the funerals. Let everybody into the area at the same time. You know, we know how serious this is when family gets die, and how easily it can transfer to family members who did get it from you. You know, and then on that, you know, the teachers union, they wrote the union group wrote a letter about this, and they said about the difficulty forcing the masks with non-special needs kids, let alone the special needs kids. And what about things like the bus? How do you make that person?
Right.
You know, and then to things like the time spent on enforcement versus the classroom environment that's not the least, you know, the least disruptive, most easily accessible work or classroom learning environment. You know, the easiest work, I forget what the term is, least restrictive
environment.
Yeah, least restrictive environment, right? How you that when you're enforcing, you know, for any of the kids, let alone the special kids. And then on top of this, you're going to give out masks to every kid, every single state. And how much is all this stuff going to cost? Is the state going to do this? Is my property taxes going to do this? Is my income tax going to do this? The cost of all the new implementation, the mask giveaways. Other parent, you know, here raised the issue of the air conditioning system, HVAC changes that you would have to make. If you had a compatible system where you could even make those changes, and not all of them are based on the air handlers, how much is that going to cost? And this is for all schools across the state, let alone my school, local district, which are already having the problems, which is how I know Jeff. Do you like that? The staff and other school environment adjustments. There's so much going to pay for all this. Where's this going to? How are you going to throw that together in 2 months if you can't even do distance learning in 2 months? You know, I don't understand how they think that they can actually pull this off and not us all. You know, and this is saying from somebody who's experienced, you know, family deaths from this. You know, everybody's been affected to a degree, but it really pretty bad and hurt the kids. You know, we lost close family. You know, so I'm just wondering in what world are they, you know, they're living in where they want to reopen. You know, what do you do for special needs kids who aren't comfortable with going back to school? You know, what do you do for, you know, all the kids? I mean, like, comfortable because of the dangers that are going on that are fairly obvious. I mean, especially if news, look at the numbers. How are they even considering opening the schools? And as concerned parents, not just because we love our kids, but because we ourselves don't want to contract this and die, let's be honest, it can kill us. What we do to even, you know, have the discussion with the state, tell them, no, I don't want this opening my kid remotely like you. It may not be an ideal situation, you know, because obviously a school with a classroom environment is great, except that you don't have a normal classroom environment, so it's a moot point. You know, we realize that it's going to be a perfect situation, but at least so that we don't die, we're not affecting each other. At least we're not putting the numbers up. We're not driving the cost of all this stuff up. I mean, is there any way to even address this to just say no? I mean, is this literally going to be shoved in our faces by force? I mean, what do you do? How do you approach that conversation considering all of these concerns?
I think, David, exactly what you're saying is what's going through everybody's mind, and as far as that, but Andy did make it clear that people are not going to be forced to send their kids to school. They will be able to opt out or to choose distance learning. But you're right. These are exactly the concerns that's why the state is asking us, what are parents saying? And so I'm really glad that you chimed in to join us. So thank you very much.
I was just on a my local school board meeting and hearing parent comments. And one of the parent comments was somebody who was taking exactly the opposite position, that education's critical, that I've got to go to my job. I work in a hospital. I need somebody to take care of my kids. And I am, you know, no matter what you do, please open schools. So there is diversity on that issue. You know, it's not a democratic vote. But I do think that your views ought to be expressed both to your local district and to the State Department of Education. And we're glad to provide you addresses.
And
May I
David,
comment
let me
about that
just
real
say one thing, well, a few things. First of all, I'm very sorry for the losses in your family. This is very
Well,
difficult.
thank
And one of the things we have to be aware of is that there are many students who are going back to school and teachers who have experienced trauma during the pandemic with losses such as yours, and we have to be very sensitive to that. There are many teachers who have reported to us who have been doing extended school year distance learning or in-person learning, and some of that has been reported going well. And just as Andy said, for every teacher you can find who says there's no chance I feel comfortable going back, there's a teacher who says let's get back in the classroom. For every parent, whether it's a child who has a disability or not, who says, you know, I'm really afraid, I really don't think that I want to send my child for my health, for theirs, for everyone's. There are many parents who say, I can't imagine going another month, 2 months into the school year without services. My child desperately needs them and they have to be in. One of the factors we've seen a huge difference for those families who are able to effectively provide distance learning is whether you have a 1 or 2 parent working household. If both parents work, distance learning is virtually impossible, even for students who are not struggling academically or socially. We don't remotely profess to have all the answers. One thing that is essential is all of you out there listening need to make your position known, because unfortunately, a lot of the data that the state is relying upon has come second or third hand. So they've taken, you know, we want to do a little poll here of you all about how you all feel, but we're not going to claim that that's a scientifically valid poll. A lot of the data the state is relying on is what is being reported to them by the administration, not necessarily from each teacher, each parent, etc. And so you need to make sure, all of you, that however you feel about this, you make your position known. But the state of Connecticut has been, to their credit, the one thing that I think we all agree has been good. They are adamant that parents should not be required to send their child to school in person in the fall if they're not comfortable with that. So far, we've had at least 2 that I'm aware of, public schools who have opened for summer services who've had to close, Norwalk and now today Wilton, who've had to close for at least a short period of time. So I'm as trepidatious as you. I have many of the same skeptical views of this that you do about whether this is wise. And I think we are literally monitoring this every day. We may have a different answer for you a week from today than we have.
And let me just pivot off of what Jen just said, which is at this point, the guidance does not say what happens if one kid in the cohort tests positive or if the teacher tests positive.
Mm-hmm.
That's a really critical issue. Do we send everybody home to quarantine? That's got to be decided, and we've got to know that in advance.
You know, as long as they don't force us to have to send our kids option, not have to send them to school, we have grave concern. They're not even talking about opening other public facilities, but they're opening schools, which is the hardest place to enforce the social distance. If we at least have the option, I could live with that. Send your kids if you need to, fine, but it should be an option for people who make the sacrifices that we're making to, because obviously it's a difficult situation. There needs to be some kind of option. If the state doesn't close off, I mean, it's not the end of the world, but that needs to be not closed off. And I'm afraid that state, and hopefully, we have people who will advocate on behalf, that at least that option is open for parents that really do, insist upon that. Because,
and one of the outstanding issues that we at SEEK have been trying to work with the state on is if you are opting out, right? What will that IEP look like versus the IEP that is written for in a building?
Yes.
Because we know it's impossible, right? Nobody's fault. You can't implement an IEP in the exact same way you could do it in a building. And we're certainly hoping, as time marches on here, that if parents do opt out, that there'll be an IEP that recognizes what's happening in the distance learning versus being in the building.
Spot on. Very curious to see what they do to, to help the special needs children, like obviously I have one too, to what they can do, so that we can still implement all these things. Cause I don't want, all the time and all those things to, to go on the wayside, because still definitely services. How can we get those services?
And to the maximum extent appropriate, right?
Yes, as much as
to
the maximum extent possible, right?
And not to just let it be a pass that it's distance learning. So the foregone conclusion, it's going to be less.
Yeah, that's a great point, and I agree. Yes, thank you.
Great. Jeff, I think you had a couple things to add to David's.
Yeah.
We have a ton of questions. So sorry, I don't want to cut anybody off. We have a ton of questions.
It's okay if you got to move. Stand. I'm glad for
moving on.
Great
question, though. Good questions, Dave.
Is that a lot of districts, you can be practical with them. So to the extent that we're trying to give our attendees here some practical advice as well, right? So if you are in a position where you're feeling like your child should not go back to school, whether it be based on a medical issue, medical necessity, or that you're just not comfortable with having your child go back, and your child's on an IEP, you should be having discussions with your district now about what the distance learning planning should be looking like, so you can plan for that. And look, if you have a private speech and language pathologist that you work with, or you have a private OT or PT provider that you work with, your district may be open to collaborating with you to having some of those related services be paid for by the district. Now, that is on a case-by-case basis, so we can't make a generality, but with the clients that we work with and so forth, that is something that is actually happening across multiple districts, either through the IEP or through a confidential settlement agreement. So I would just implore you to also, reach out to your district on that too, David. And
talk to my district and talk to any of the behavioral specialists who have been involved in see if there could be arranged.
Yeah,
good idea. Thank you for this. I honestly, this is so thankful for you guys. Thank you so much for being here.
Sure. Thank you.
So Jeff, do we have results from our first poll?
Yes, we do. Thank you, Babs. So the results that have been coming in over the last hour since we went live, the question that we posed to everyone is, are you comfortable with sending your kids back into the school building full-time in the fall? The answers that you could provide are either yes, no, or need more information. And amazingly, everyone that registered for this, we had almost everyone answer the question, okay? So right now, 44% say that they need more information first. Okay, so everyone I think is in the same boat that we are in as your panelists, that we're still waiting on more information. 35% say no. And then at the bottom, 21% say yes.
Okay.
Interesting.
Well, that's interesting. And so, Jeff, we're going to ask that question again toward the end of after we finish in about 20 minutes. And
Yes.
then see if we're just curious if any answers will have changed based on something you heard tonight. So again, tonight, we're trying to do more of a listening session. We're not going to get to every single person's question or concern. However, we are going to send everything to our friends at the State Department. So if you didn't get to answer your question tonight, don't despair. We just, we're going to send it to the state, so make sure that they know that this is what you're concerned about. So Jeff, can you tell us who's our next person?
Yes, and then after this, we have someone that wishes to remain anonymous.
Fine.
That has a question. So we'll go now to Jeanette Hernandez. Hi, Jeanette. Are you there?
Hi, how are you guys? Thank you for the information. I'm a family support specialist in the Hartford area. One of the things that I did this week was talk to some of my parents, my Latino families have struggled not only with languages, but the process of it. One of the big questions that they have, because they know there is a choice, but they want to know what kind of documentations are they going to need to excuse their kids from going to the school, even if they're given a choice. Some of them are already talking to teachers and stuff, and they're like being advised to send their kids, but some of them are still afraid. Some don't understand the process, and they wanted to know what kind of documentations they might need for those kids who have illnesses or are still afraid due to anxiety to going into a building.
At this point, the state plan says you have the absolute right to keep your kid out. This is not like homebound instruction where you have to prove.
With no documentation.
No documentation. Just a letter saying I'm not sending my kid back.
Yeah.
You know, whether that changes, I don't know. But that's again, you know, one of the good parts about the plan.
One of the districts did tell one of the parents that they had to send the child back. I said to them that we're going to request a PPT to discuss it, so that I hear what they're trying to force the parent and handle. So definitely, thank you. And you guys are doing a great job. All this information really helps out.
Thank you, Jeanette.
Jeanette, to that end, and for everyone who's on the webinar or listening on Facebook or watching on Facebook, we are very aware that parents are often told contradictory things even within the same school district by different individuals. Very often it's not intentional, it's misinformation, but we're very anxious to make sure the state is aware of misinformation that is out there. So if you're aware of a parent being told, or if you're being told something that is inconsistent with what we've said or what your research or your instincts tell you, the school is supposed to do, please bring it to our attention, because we do communicate with the State Department of Education regularly, and we want them to know what parents are being told.
Absolutely, that in all capitals, Jen, that we hear that all the time. Please come to our Facebook page, write us and let us know, because we will bring it to their attention and say, this is happening, and you said this is not supposed to happen. So.
Yeah, and just to echo Jen, you know, we at SEEK as a board, we have an ongoing standing meeting with the officials with the Connecticut State Department of Ed. So we do really take all of your questions and we gather them together, and hopefully we get answers for you, but we certainly get answers for SEEK. The next question is an anonymous question. It says, are there any directives or recommendations from the state regarding diagnostic testing, both on an as needed for those symptoms and on a periodic basis for non-symptomatic students, teachers, and staff? And what is the guidance related to for contact tracing?
And the plan is not complete in that regard, and does not fully follow CDC guidance. And that's something for local districts to establish. We do have a serious nurse shortage in our schools, and imposing testing, even temperature taking requirements on nurses is going to be a very serious issue, because it is a deficit area. On the other hand, I don't know whether you've had one of these tests where they stick a swab up to try to touch the top of your skull. Incredibly uncomfortable. There is an issue about whether we want our kids to be subject to that on a regular basis.
Jeff, there's a Christine Smith who would like to be called upon as well.
Sure, absolutely. I was up. We'll get to her right after this one. There's also some guidance that just came out that Andy may have mentioned from the CEA just this week. And again, it's guidance, but it's indicating that all.
Jeff, just let people know who the CEA
Yeah.
is.
Oh, yes.
Beat me to it, Jen.
Go ahead, Jen.
The CEA is the teachers union in Connecticut, and I just want to make sure everyone is aware that one of the two.
One of the two. Don't
Right.
cut out the
Say
A.
what they stand for. Connecticut Education Association,
That's right.
Correct.
and then AFT, or is it, what's the other one?
Well, it's American Connecticut branch of American Federation of Teachers. AFT is the larger and more radical than the national ones, but CEA is the larger one in Connecticut.
So the CEA just issued about a 20-page guidance for safe learning. And one of their 6 pillars is to institute testing for all students, teachers, and staff who return to school once per week, and instituting contact tracing protocols. Now, again, as Andy's mentioned, this is just guidance. This doesn't mean that the districts have to do this. And if they are doing this, are they doing this with state funding or a district funding? And also, if we're asking our kids to wear masks to school, which is going to be challenging in and of itself, now are we also requiring the nose test on a weekly basis? And, that can be very challenging on a number of levels. But there is on it, I guess.
But Jeff, just for some clarification, isn't it sort of suggested requested guidance versus they can't enforce that?
No, it's their critique of the state plan. Just
Yes, they're asking for the state to
Not
consider that.
guidance
I
at
just
all.
wanted to make sure.
Yeah.
That's understood.
But I do want to say about the funding issue. The costs are massive, and particularly if you start following CDC guidelines on buses, then they just go through the roof. The state's talking about using CARES Act funding, which is really quite limited, to supplement this. What's really happening, as much as I hate the term, this is the largest unfunded mandate in history. Massive costs being imposed on districts. The state budget is well, it's not currently in deficit, but the budget that's going to be coming up in September is wildly in deficit. And the federal funds, it's currently in Congress, the fight is between a $1 billion and a $3 billion package, very little of which goes to education. So the answer to, I guess was Mr. Steinberg, is it going to come out of your pocket? Yes, it is.
Okay, I found Christine Smith. Christine, are you there?
Yes, do you hear me?
Hi.
Yes.
Hear you.
I could have been on video. I don't mind. I look good today. Okay. All right. I'm a paraeducator, and I'm also a parent of one that just graduated to virtual learning, 18-year-old. But my concern is, unfortunately, the lack of equity is still troubleshooting. It's troubling, especially when suburban districts have resources for this kind of plan. Yet the schools that have majority of Black and brown students, those high need communities do not. And just to piggyback on that, high poverty district students with special needs and ELL students will be at greater risk and have lesser safety protections. And I just found out this recently. History shows that severe illness and death rates tend to be higher for racial and ethnic minority populations during public health emergencies than for other populations.
And, unfortunately, here we are, maybe 15 years with the objections of the Connecticut Coalitions for Justice in education funding versus REL. Here we is, I think almost maybe 15 years after that judgment was posed, and we're still pretty much back where we started from. So it's very unfortunate.
Can I just give you some figures there? This is not COVID related, but when you look at average per pupil expenditure by districts, for districts that are 0 to 5% Black or Hispanic, 0 to 5%, the average per pupil is close to $20,000. For those districts that are over 50% Black and Hispanic, and there are 38 of those districts accounting for better than a third of the students in the state, the average per pupil is $15,000. So we've got systematic, institutionalized racism in our school funding system right now. This clearly COVID is making it much worse.
Absolutely.
If there's one thing that, Christine, if there's one thing that this school closure as a result of the pandemic has truly brought to light, is the significant, profound discrepancies between inner city school districts and primarily school districts that make up minority students. The inequities are profound. When we first started to do our SEEK webinars, one of the very first webinars that we did, I'm not sure if you listened to that, but we did a webinar on the inequities and injustices across school districts. I mean, it has been a profound eye-opener on a systemic level. It's always been there, but it's really been put there under a microscope now because of school closures, where we have clients that aren't even accessing anything within the inner cities because school districts aren't able to contact the parents because they don't have their phone numbers, okay? If you have not seen that video, that webinar, Christine, we recently posted all of our videos onto our YouTube site. So I'd encourage you, we have a lot of speakers across the state that joined us in that webinar for you to listen to as well. But thank you for your question.
If you go to the website, there's a Seek This Week page. You could watch the video straight from there. There's a button, or you can go to our YouTube channel, which is Seek CT, and subscribe. And I'd also just want to say, Christine, that hopefully now that there are so many eyeballs on this issue, right, that the pressure is on for this to change. And that doesn't mean that we all need to take our foot off the gas, because we can't. But, perhaps one of the silver linings is out of this pandemic is that there's nowhere for this issue to hide anymore. And hopefully we're all going to come together and turn it around. At least that's certainly our hope and my hope. But thank you for bringing it to our attention and everyone else's.
Yes, thank you. Thank you, Christine. Jeff, did we, thank you, Christine. We really appreciate that. Jeff, did we get a chance to send the second poll?
So we're learning polling right now through our webinar.
Yes.
And I think you can only add them in the beginning, so I don't think I can add another one right now.
That's fine. We were going to poll again to see if you guys have changed your mind. But there's a lot up in the air right now, and that's what, even what we're saying, it's guidance, it's not, we're not sure. There is one question, Jeff, that I have not seen anyone talk about, and I'm curious about. It was Christine, I'm just going to read your question if you don't mind. Will they have training for school bus drivers and matrons of the guidance on how to keep children safe while riding on the bus?
Look, the plan I just looked at from Stonington talks about bus monitors for the first 2 weeks. Somehow kids are going to learn to keep on their masks and to keep their seats in the first 2 weeks. I don't believe it. As I've always said, the school bus is the heart of all evil. Without, asking a bus driver to pull over the bus if somebody doesn't have his mask on, or to pull over the bus if a kid gets out of his seat. It's just going to be a disaster.
Yeah.
That's something that's really got to be worked on. And it's an enormous cost issue, obviously, to have a monitor on each bus. The state plan talks about full capacity buses. The CDC guidance says it should be opposite rows every other row, one kid in a seat with masks. So the state is really departing from what the CDC is saying in terms of doing busing. It's an enormous issue.
Well, and of course, many people choose to drive their children to school. This is not something that all parents can do, understandably. But if you've ever been in those bus lines, I'm sure those are about to get longer. Not bus lines, but the car lines with parents dropping off their kids.
Well, I see that as one of the enormous inequity issues here. You know, if you're in a rural district, if you're in an urban district where your parents may not have a car, if you're if you have a single parent who's working, this effort to force parents to drive their kids, I think, is an enormous area of difficulty, an enormous area of discrimination.
Well, Andy, can you speak to that? Because I wasn't talking about the issue that forces the parents to drive their kids. I was just saying that some people may choose that. But could you talk about that? Because that was an initiative that came out through the state.
Well, I mean, I think that, you know, the state is very clear that parents can be encouraged to drive, but they can't be forced. But the line between encouragement and compulsion is pretty thin. And I'm sure that, and then you got the issue of the kid who's out of school for a couple of weeks. Parent says, okay, I'm going to send him back to school. That means that every classroom has to be reconfigured. Every bus has to be reconfigured to accommodate this kid. Or else, if you decide to keep your child out at the beginning, are you stuck keeping him out for the whole first semester, for example? This is an incredibly complicated issue, and there are no easy answers on that. But, you know, on the compulsion to drive your child to school, you know, I really worry that is an issue that's going to serve to discriminate against kids from urban districts, poor families, and the like.
Okay, I'm gonna wrap this up here just because we have more questions, and I'm so sorry we can't get to everyone's question. But please send it to us, and we will again get it to the state and make sure that they know that this is what you're thinking of and these are your concerns. We are going to do a really quick, please, round of takeaways. Yes. Meaning this is just a little tip to think about for the next couple of weeks until we come back. So Jeff, let's hear what your takeaway is.
My takeaway is just from seeing all the questions that are coming in, you know, there's more questions than answers right now. And to the extent that you're concerned, you should be voicing your concerns to your local district as to what your concerns are. And if you're planning to have your child not go back to in-person schooling, start to plan accordingly as to how you want to make that happen, whether it be through the school district or with some private related service outside providers. That's my takeaway, Babs.
Great, thank you. Andy, what's your takeaway?
Yeah, two things. You know, one, with a little trepidation, when a reporter called me after the state plan came out, I called it incredibly reckless. And I thought maybe I was going overboard, but after tonight and after studying these plans for a while, I'm convinced that that was the right reaction, not a vindication I wanted. The second takeaway is, I'm going to repeat this. FAPE still exists. The IDEA has not been suspended. You have all your rights to a free, appropriate public education, whether you're in a school building or at home. And there is no provision for FAPE light during COVID closure, despite what school officials may tell you.
Great, thank you. Jen.
So my takeaway is that, you know, we've been saying since March as SEEK that, you know, you need to be talking to your district, you need to be communicating with them, you need to be planning. They need to be planning. We've said it over and over and over again. And I think what we found is that July 1st came and everyone was so sick of trying to manage their children's distance learning and their job and their health and their household that I certainly saw that a lot of people sort of shut down from even wanting to talk about it. And if you're anything like me, you woke up and suddenly said, oh my God, it's July 21st and we only have a few more weeks before school's supposed to start. And frankly, the planning hasn't been done. I think the number of questions and the variety of them speaks to the fact that people still are unsure about what's going to happen. Parents are, teachers are, administrators are. And so please continue. It's sort of what Jeff said, but I think it has to be repeated. You just please be communicating with your team, with your child's IEP team about whatever planning is necessary, whatever you decide, which you as the parent have the right to do. Whatever your decision, please make sure you're communicating about the things that you're worried about that you've been expressing to us so that there's a plan. Having a plan at least gives you the assurance that you're not starting, or your child isn't starting the first day of school completely unhinged and without anyone having an understanding about maybe what's been happening that wasn't in place or wasn't being exhibited before school closed. So have a plan.
Julie.
Okay, I'm going to go back to talking about the fact that please take care of the precious, take advantage of the precious little time that is left on extended school year services, if in fact you are receiving ESY, to reach out to your team to say that you'd like whatever viral health and safety skills that are appropriate for your child to be part of the IEP, to be an IEP goal and have objectives, right? If you can't do it now and call a PPT during the summer, which I'm never one to just have a PPT just because you can, try to have it as soon as you can. But at some point, you know, if you get pushback from the school to say it doesn't need to be an IEP goal and objective, then say you'd like it to be added to your the concerns that you have under adaptive skills and what that the impact of that lagging skill is on your child at school and in the community, so that you can support the fact that you'd like it to be an IEP goal and objective.
Thank you, Julie.
If appropriate, and if that's what you think.
Thank you, Julie. Thank you very much. I have one quick takeaway, just repeating when we had Commissioner Cardona on about a month or so ago, and he talked about distance learning. And he said, when we started, it was like you fix your tire and you put the donut on the, the car. And we've been working with the donut since March, okay? So if you opt for distance learning, which many of us may have no choice, or you may make the choice, insist on the real tire, okay? It will be improved. So even the Commissioner of Our Education has admitted it wasn't so great in March, but we've had lots of opportunity to improve distance learning. So it doesn't have to be what it was in March. It doesn't have to look exactly the same. So that may be the decision that makes you feel the safest. Again, please send us your questions. Please continue to send us your questions and concerns. We hear from the state. They want to know. They want to hear. And we are happy to tell them. So I'm so sorry to wrap this up just because we have so many. We could be here all night. But thank you so much, everyone, for joining us.
Thank you.
Huge thank you to Milestones Behavioral Health for sponsoring this webinar.
Behavioral Services.
They have, Milestones Behavioral Services. They have back to school services, and you can find out more about at their website, which is mbs-inc.org. Okay.
One more thing, Joel. One more thing, Babs. Somebody requested that the chat and the questions and answers be saved and made available. If we can do that, Jeff, and take out anything personal. We'll do that. We'll do that.
Excellent. That's great. So just so you know, Seek This Week is coming back. We will be back the first Thursday in August, which is August 6th at 7 o'clock. You can send questions to us at seekthisweek@gmail.com. who knows what the world will be like by August 6th. We'll have a lot more plans, we'll have a lot more decisions, hopefully, and we'll have a lot more answers for you. And we also will be rolling out our Seek membership program, and you'll hear about that in the next few weeks. Take a look at our website when you get a chance at seekct.com. Gentle reminder, we are a nonprofit. We do truly appreciate donations in order to cover our operating costs as we continue our mission. Thanks so much for joining us. Feel free to send us questions, concerns. If you hear about something that doesn't sound so great, or I don't think they can say that, they're probably misrepresenting something that the state has said. So send it to us. Thank you very much and good night.
Thank you, everyone.